Let me introduce a couple of friends, a friend of mine from the Michigan State Medical Society. Steven Newman is the president of the Michigan State Medical Society, and along with Julie Novak, the executive director, these two individuals speak for doctors across the state of Michigan. They are fully involved in this, understand the importance of health care, dealing with pain, managing chronic illnesses and debilitating disease, and I'm very pleased to have Dr. Steven Newman here to say a few words. Doctor?
Thank you very much. The Michigan Marijuana Act of 2008 was a very poorly worded act and consequently led to a lot of confusion, not only on the part of our patients, but on the part of physicians. Consequently, we are looking forward to this legislation that you have vigilantly been forwarding, as well as our legislators, the bipartisan legislation that supports this. What we're most interested in is getting a bona fide physician-patient relationship, a bona fide physician-patient relationship that we can define. There's been no other drug that has required this, but this is what the Act has stated. So we need to define that. And a bona fide physician-patient relationship is no different than what I do on a daily basis in the trenches, seeing patients with chronic diseases, chronic pain conditions, and the like. A bona fide physician-patient relationship is defined as not only seeing the patient, doing a complete history, physical examination, review of outside medical records if appropriate, ordering the appropriate tests, but also reviewing with patients what are the advantages and disadvantages of either medical marijuana, as it's so called, as a result of other alternative medications that might be available or other treatments that might be available. It's absolutely essential that physicians have these types of guidelines in order to prevent many of the abuses that have occurred. We look forward to this legislation, to this bipartisan support of this legislation, because this will help not only physicians treat their patients, it'll help us treat the Michiganders who come to us and are entrusted in our care. Thank you.
Thank you, Dr. Newman, for your involvement and participation here today.